Hypertension, the Silent Killer by Shannon Dorchak, Spring Arbor University. Hypertension is also known as the silent killer due to often presenting itself with no warning signs or symptoms. The purpose of this presentation is to discuss what hypertension is, the prevalence of this disease, how to diagnose it, and how to treat it, and patient education. Prevalence and demographics. Hypertension is the leading cause of cardiovascular disease. A staggering statistic I read was more than 360,000 American deaths in 2013 included high blood pressure as a primary or contributing cause. Mathematically, that is almost 1,000 deaths per day. According to LaCruz and Kletting, data from the National Health and Nutrition Examination surveys have revealed that about 30% of hypertensive patients in the area were not aware that they even had high blood pressure. Therefore, they were not receiving treatment. Data released by the NANES states that in the year of 2016, the prevalence of hypertension was 29% and the percentage increased with age. Hypertension was noted to be diagnosed in more non-Hispanic Black than non-Hispanic white. Data revealed that from 1999 to 2016, overall the prevalence of hypertension was unchanged. Hypertension is not an equal opportunity disorder. This affects people with certain demographics more than those without. Regardless of prevalence differences pertaining to race or age, it is quite evident that hypertension is a very common medical problem. Pathophysiology of hypertension. The actual cause of hypertension is not entirely understood. Maintaining a normal blood pressure is dependent on balancing cardiac output and peripheral vascular resistance. Hypertension is instigated by increased cardiac output and/or increased peripheral resistance. The simplest way to explain the concept of hypertension is to consider the analogy of the garden hose or hose pipe. The water needs to exit the hose at a certain pressure, which will allow it to reach its destination. The force of the water spaying out at the end is proportional to the pressure within the pipe. Clinical presentation of hypertension. Not all persons present with signs and symptoms when they are hypertensive. High blood pressure is a largely symptomless silent killer. A variety of symptoms may be indirectly related to, but are not always caused by high blood pressure, such as blood spots in the eyes, facial flushing, dizziness, shortness of breath, headache, nosebleed. Risk factors of hypertension. There are numerous factors that increase your chances of having hypertension. When you're able to understand these risks, you can reduce your chances. These risks are classified as modifiable or non-modifiable. Family history, you have an increased chance of diagnosis if your parents or your close relatives are diagnosed with the disease. Age, as we age, our blood vessels gradually lose some of their elastic quality, which can contribute to increased pressure in blood. Gender, until age of 64, men are more likely to be diagnosed with hypertension. At age 65 or older, women are more likely to be diagnosed. Race, African Americans have a higher prevalence than any other race in the U.S. African Americans also tend to have it more severe. Health history, hypertension is more prevalent in persons with chronic kidney disease and diabetes. Lack of exercise, exercise is amazing for our cardiovascular system. Unhealthy diet or being overweight, a diet too high in salt consumptions, calories, saturated trans fat, and sugar carries an additional risk of high blood pressure. Making healthier choices can help lower your blood pressure. Cultural considerations with hypertension. Data from NANES reveal the racial disparities with Black men and women having significantly higher rates of hypertension than white men and white women. Research also indicates that there is a poorer medication adherence with African Americans. The racial disparities in hypertension and hypertension-related diseases outcomes have been related mortality and morbidity risk compared with their white counterparts. Health promotion. With a hypertension diagnosis, the patient can care for self by first obtaining the pertinent information about hypertension. Patients are given the opportunity to attend educational meetings and social meetings concentrating on the condition. From there, the patient can learn how to deal with the disease in case of occurrence. Monitoring the blood pressure is the most important step. An individual knows the normal blood pressure and the blood pressures that can cause hypertension. It is also essential for one to keep living the lifestyle that facilitates high blood pressure reduction. Following instructions as directed by a physician can help a person live a normal life without hypertension existence or be in control of the disease during the occurrence. Hypertension is a common disorder that affects a large proportion of the community. It is usually asymptomatic and is detected on routine examination or after the occurrence of a complication such as a heart attack or stroke. The best way to diagnose high blood pressure is to have your blood pressure measured. A blood pressure reading is taken with a pressure cuff called a sphygmomanometer. The cuff is placed around the upper arm before manually or electronically inflating it. To diagnose high blood pressure, your doctor will take 2 or more readings at a separate medical appointment. Your doctor may run additional tests to confirm an initial reading. To obtain additional information about your blood pressure, your doctor may recommend wearing a blood pressure monitor to record readings over a 24-hour. Lifestyle changes are crucial in hypertension prevention. Avoiding alcohol, making better food choices, exercising, smoking cessation, stress reduction, and quitting cigarette smoking can help with prevention. A diet rich in fruits and vegetables, lower fat dairy products, and reduced saturated and total fat, like the DASH diet, is now strongly recommended as the optimal diet for preventing hypertension. Patient education. For most people with high blood pressure, a doctor will develop a treatment plan that may include heart-healthy lifestyle changes alone or with medicines. Heart-healthy lifestyle changes such as heart-healthy eating can be highly effective in treating high blood pressure. If medications are needed to control hypertension, they may prescribe more of the following: angiotensin-converting enzymes or ACE inhibitors, angiotensin II receptor blockers or ARBs, calcium channel blockers, or even diuretics. If your doctor prescribes medicine as part of your treatment plan, keep up your healthy lifestyle changes as well. The combination of medicines and the heart-healthy lifestyle changes can help control and lower your high blood pressure and prevent heart disease. You must also stay consistent with your follow-up visits, stay compliant with your medication prescriptions, and monitor your blood pressure at home. Patient discharge education should also include knowing the signs of a heart attack and stroke-like symptoms. Cardiovascular disease is a leading cause of morbidity and mortality in the United States, and its prevention and treatment remain a priority for the medical community. Do not let yourself become a victim of this silent killer. You can do this by making some simple changes in your lifestyle. Change your eating habits, begin an exercise routine, take your medicine as prescribed, and you can control blood pressure and you can ensure a healthier tomorrow for you and your family.